Hi there, it's Dr. Birk here today. I want to talk to you about a really key important component of what may be causing your back pain, your leg pain, your sciatica symptoms. What is the true root cause of this? Where does it come from? So the most important thing I want everyone to understand is that we have spinal discs in between the bones of our spine. What these discs are is a cartilage material. It's the same thing our nose and ears are made out of. And what that tissue is, it's very flexible. But the tissues also do not have direct arteries or blood flow to them. So the only way a disc tissue can stay healthy is through the bending and movement of our spine. So when bones are in good alignment, that's what creates a healthy disc. So this, every time you see this bending and moving, we're getting circulation. We're getting fluid exchange in and out between the vertebrae to the disc, bringing in new nutrients, taking out waste materials, bringing in oxygen, and keeping that disc healthy through motion is the most key component to avoid back problems, pain problems. So when we see that, that creates the space for that nerve that's coming through there. So that nerve is obviously in our back, or it can go down our leg. So when these nerves are open, there's no pressure, there's no problem. What is happening when people get back pain or further exacerbations down their leg is that the vertebrae begin shifting and locking in a bad alignment. This can come from countless things. Sitting for long periods, bad posture, sitting at a desk, driving for long periods, obviously falls, injuries to our spine that can impact that alignment, and just day-to-day repetitive strains. So as you see that locking, what we're having now is pressure on that disc. This is called subluxation of the spine. So as a chiropractor, that's my first priority. Finding that subluxation is the root cause of this underlying disc problem, degenerations that come as a result of that. So as we see that disc getting squeezed, now we're not getting nutrients back and forth in there. That disc is starting to lose height, so that means there's less room for that nerve. That nerve getting less room may or may not cause pain, but it's definitely the underlying beginnings of a problem that's going to develop. As that remains that way, we would begin to potentially start feeling symptoms as that disc goes further and further into a bulging situation like we see here, and worsening, and if it's not corrected, a herniated disc. Herniated discs are very serious. They can need surgery, but there are other treatments that can avoid further progression. So looking at that, that's obviously what causes shooting pain, a severe numbness, tingling, drop foot in many cases, as the foot can't lift, and there's certain tests we can tell which nerve root it is. Obviously getting that disc material back is a priority in correction of this. So what I want to show you is that this is what this would look like on the superficial, on the top end of it. You can see that the disc, the rings of breaking, the disc material has leaked out, and that's what leads to that herniation. So we never want to allow that to happen, and there are things we can do preventing that further degeneration from becoming permanent, and even surgery is not a great treatment for this. Patients who have had failed back surgery, it's because the root cause is still not corrected, and surgery removes tissue out of an area and causing further collapse, meaning the other discs start getting worse and worse over time. So in the next video, we're going to explain to you the Back to Life method. It's taken me over 20 years to develop this unique series of treatments that we put together for patients who have these conditions. Bulging discs, herniated discs, spinal stenosis, sciatica, all these different things that can be related to what we've talked about in this video at the root cause subluxation and further degeneration, how to correct that with the specific methods that we've developed. So I look forward to sharing that with you on the next video.